the ability to transcend time. This superpower manifested itself in his putting the patient before everything else, every single time. Dr. Bhat led the Department of Anesthesia at Ganga Hospital from 1993 to 2012. Such is the formidable power of his leadership that even today, his principles and actions are the standards to which others aspire. His pioneering work in the management of trauma victims and in regional anesthesia and nerve blocks has transformed the lives of many. Gone too soon, but never ever forgotten. Dr. Ravindra Bhat.
So now I would kindly invite Dr. Rupender Singh ma'am to come on the stage and introduce Dr. Sandeep Diwan sir, who has humbly consented to deliver this prestigious oration.
Thank you and a very good evening to all of you. So it is my honor to introduce Dr. Sandeep Madhusudan Diwan, a highly respected anesthesiologist and pain physician whose career has been intertwined between advancing the science and practice of regional anesthesia in India. He is a distinguished alumnus of Government Medical College, Miraj, and he went on to achieve top honors in his postgraduate training before dedicating his career to clinical excellence, teaching, and research. He is currently affiliated with Sancheti Institute of Orthopedics and Specialized Surgery, Pune, where he not only practices as a consulting anesthesiologist and pain physician, but he also heads the academic and the research program in anesthesia. Dr. Diwan's leadership has been exemplary. He has been a core pillar in the formation of Aora India. He has served as the president and the academic director of Aora. He also plays an important scholarly role as the editor of International Journal of Regional Anesthesia and contributes globally as a pre-reviewer for leading journals such as Regional Anesthesia and Pain Medicine. A true visionary, Dr. Diwan, he has championed the concept of nationwide accessible cadaveric workshops, very nicely known as CRAB, by forming the Cadaveric Board of Studies and conducting regular programs at reputed institutions all across India. He is a renowned international recognized, serving as a regular faculty at the ESRA Congress and other global forums. Through his international collaborations, he has positioned Sancheti Hospital as a center of excellence in regional anesthesia, especially in the field of cadaveric research and education. He has over 100 publications to his credit. His academic and clinical contributions are complemented by a life rich and diverse talents. As a student, he was an accomplished all-rounder athlete, excelling in football, cricket, and tennis, often representing his institution at state and national levels. He has won over 110 awards in various athletic and sporting events. Equally, he is a passionate musician, having trained in sitar from childhood and even performed in the presence of legendary maestros of India. Beyond medicine and the arts, he remains rooted in his farming background, where he combines tradition with innovation, adopting modern technologies such as mobile-based farm management and drone-assisted cultivation. Ladies and gentlemen, please join me in welcoming Dr. Sandeep Diwan to deliver his oration, very aptly titled, My Journey into Regional Anesthesia.
Sat Sri Akal. Good evening, everybody, and My aunt, she has traveled the length and breadth of Punjab, and along with my parents who are in background, they collected data and documents from all over, and finally she came out with a book, The 10 Gurus of Sikh, which she presented to the Sikh community. And probably this has been ingrained in me for all these years, collecting data and documents. Friends, good evening. Before I begin, let us pause for a moment and honor this person in frame, Dr. Bhat, who has been recently introduced, who has left a powerful legacy behind us, who has inspired us a lot. He was a man with mission who used to move around with a local anesthetic in a syringe and a hypodermic needle which was attached to it, and perform blocks in the casualty rooms. This paved the path to the on-arrival blocks, which has been implemented in many institutes throughout India as well as the world. He thought that anesthesia was not just a duty, but it was an occasion or an opportunity to serve with precision and care as well. He always thought that it's important to have human connections. He built human bridges. He stayed rooted to one important institute in all his life. And this was very important, where he inspired people, many. He was always calm, quiet, composed, always stand in a corner of a conference hall, listening very carefully to what the speaker says. And then he would politely ask questions at the end. Friends, his qualities, everything he had: humility, kindness, courage, and all these things has been imbibed in him. And so when I begin my journey, I think we should remember him throughout, not only today, but throughout our life. So this is Dr. Bhat for you. Namaskar from me and my family. So these are some of the pictures, old ones, where I come from, my native place, Miraj, which is surrounded by greenery. Confluence of rivers, a tower standing in the midst of the town. I lived in a fort. This is called as the Killa. And we export a lot of sitars, and I used to be a part of it, the concerts. I would like to begin my journey from 1994 until 2025. And this was the time when I practiced in the government hospital, but then I started my private practice. And when I plunged into this as a freelancer, I knew that I had to face a lot of obstacles. So in 1994, my first job in the initial days was just to deliver adequate fundal pressure. Because my wife, she used to frantically call me and ask me to deliver the fundal pressure. And when I used to descend the steps in the morning, the woman used to whisper that he is the one who delivered the baby. So I can understand my wife's plight, but she remains my best friend. Together we did a lot of charity work until we came to Pune. And this was at Gondole Charitable Trust, where we used to go on Saturdays and Sundays. And I think each one of us should spend some time in charity. The initial years were full of uncertainty, chaos, leading to a lot of confusion, disorder. And I was quite surprised that some of my own fraternity colleagues, they used to ridicule me. And they used to sometimes humiliate me as well. And this was very shocking to me. I was in private practice when I was pulled out by my wife, my father, and one of the pediatric surgeons here in frame. And I loved neonatal anesthesia a lot. And we used to use ether anesthesia. And it was very impactful. You did not require any analgesics. Until we started using halothane and muscle relaxant, that triggered the concept of regional anesthesia. Can you cut the volume? And the initial blocks were just the thoracic paravertebral blocks. The initial blocks were just the thoracic blocks, the paravertebral blocks which were landmark guided. And I thought that I was the best neonatal anesthesiologist. Until in 2005, I was invited to this pediatric conference where I met Rafa Hanala and Manoj. And then I came back and I saw that I had to do a lot of things. So we started using the stimulating catheters. So we had a spectrum of blocks, right from the traditional or conventional blocks to stimulating catheters. And this was published recently. In the first World Congress where I was invited, I delivered 3 lectures and all were translated in 7 languages. And I cherish this moment because I shared dice with Charles Cote, who is a French guy, and he had a book in his name. And I thought this is a very fantastic moment for me. You pour ether in this bottle, that's called the Came bottle. You shake it, the patient goes deep. You disconnect it, the patient becomes light. That simple was anesthesia in the past. These needles, when they used to get rusted, they were discarded. That was spinal anesthesia, and I got bored with this. So I came across this person who delivered a lecture where he said that you just require a local anesthetic in a syringe, a needle attached to it, and the limb goes numb. I was quite surprised. Coming back, the clicks and pops became the way of life. And we added a lot of these blocks, interscalene and supraclavicular. When a surgeon called me for his first case, this was a case where 3 anesthetists had failed to give a spinal anesthetic, not a mistake of theirs because the whole spine was calcified. So I knew that the gateway to spine was closed. I had to go paraspinal. And this was the first time I did the lumbar plexus block. And I achieved this, but I never knew that I had to give a sacral plexus block as well. So I gave a very small dose of ketamine. Word spread that I do a lot of these awake blocks, so they started calling me for breast surgeries. So we added these thoracic parietal blocks, blind techniques. What is it? Just hit the transverse process, go beyond that, inject local, that's it, 20 ml. You did not require a neurostimulation, no ultrasound. That was the time in the 1994 until 2014. And these ladies were sent back in the evening or maybe the next day morning. And this was ERAS we were practicing at that time, which I came to know recently, that this is ERAS, that what we were practicing, but never published at all. And I used to ferry these patients in my car to the CT scan suite, get the contrast CT done, because I was interested in where this drug diffuses, in the wanted place and in the unwanted place. And I used to pay this myself. So I think that each one of you should have a financial portion of yours dedicated to academics. Not everything was smooth. I faced a lot of block failures and complications. And in one instance, I had 4 pneumothoraces in 1 week. The surgeon said, "Stop, Sandeep, and you need to relearn." So I went back to the library where I got hold of this Kulenkampf article, which everybody should read. It comes from 1927. And I came to know that the first rib is a very important structure. You can look at all the relationship it has. And we used to hit the rib, withdraw the needle, and inject local anesthetic. That used to be the supraclavicular plexus block. And what do you do now? You see it under ultrasound and inform the delegates that you see the rib, get all the structures above, and insert the needle. So for 100 years, the rib has remained a very important structure, and it will remain in future. The best part, I was devoured of social media. It distracts your attention, it dilutes your knowledge, and it destroys your brain. I think our brain is getting rusted with this social media, especially with AI and ChatGPT. And I think you should relook, relearn. For limited use, agreed, but not for an extensive use. In Delhi, we did the first AIMS. GP Duraja had conducted this workshop, and we started doing a lot of interscalene, infraclavicular, lumbosacral, popliteal blocks, and we did left and right. All of us, myself, Ashit Mehta, and Guru Prasad, we did a lot of these workshops elsewhere. Parallelly, Rushali, Gopal, Bala, they used to conduct these workshops everywhere throughout India, and the word spread that there's a group who performs these workshops, and we were invited everywhere throughout India. So a time came when Surjit Giri invited us in Northeast, Tejpur, Jorhat, and Dibrugarh. And it was here that we demonstrated our skills. Bala and myself had been here 3 or 4 times. And we performed the blocks, and at the same time, we also learned a lot and had valuable inputs from the delegates as well. Additionally, I started doing pain management. When you have a needle in your hand and you're skillful with your blocks, you can do anything from acute pain to chronic pain, is what I thought. And I was invited to one of the global pain updates in Mumbai. And the organizers were stunned that a person coming from Miraj in a room in a remote rural area is performing blocks and he's demonstrating and his skills. And I presented on CT-guided neurolytic blocks. And in one instance, I did live workshop on trans-aortic celiac plexus block, where the needle goes through and through the aorta, you inject the drug, go beyond it, and inject the alcohol or phenol for cancer pancreas. Dr. Subhash Jain, one of the directors of Sloan Kettering pain department, he came up to me and congratulated me. That is a moment I still cherish and I still remember. This is a needle. The people owning the needle are here. And I feel that it's a very important concept. What is the concept? This is my concept. I don't know whether it belongs to everybody. I think it should belong to everybody. At the tip of the needle, you have the trust and faith of the patient. At the hub, you have the knowledge, confidence, and zeal of the performer. And the shaft is the one which binds it together. And this is the very essence of regional anesthesia, which is filled with full of precision, perfection, and passion. And I think that each one of you should be having this concept within yourself, which will drive your passion to the end. In 2005, I met Andrew Van Zundert when I was presenting abstracts in the World Congress in Rio. It is at this point that he was presenting thoracic spinal. So coming back, I said that we should start this. And I'm very fortunate to have surgeons who said very much yes to all these things. I practiced the 1 ml bupivacaine at that time in 2006 and 2005. Unfortunately, the whole data I did not present it, which now they claim that what is the thoracic segmental spinal. And they make a lot of, loud about it. We used to have all these awake patients, but I used to combine them with interscalene blocks to decrease the shoulder pain and the diaphragm movements. So we used to combine a lot of things. And Andrew Van Zundert, I recently met in Oslo. He received the award, the Carl Koller Award. Word spread in 2008 that ultrasound is going to become the future. So again, I went back to Schwettwinzen, Germany. This is the palace where the conference was held. In this beautiful auditorium, it was the first time that I witnessed that you have these hypoechoic structures which are sandwiched between the muscles. And if you get a needle close to it, you are going to block the nerves, the brachial plexus. And I was stunned that you could see the structures and you could visualize the spread and you could get an outcome. So are we going to really adopt this in India? That's what I thought. So coming back, when these guys, they presented everything to us, fully knowledgeable, they shared their data, they shared their knowledge with us, and I was very happy coming back. We traveled through Alps to Innsbruck, where we did the first cadaveric workshop. And I think that triggered in my mind that we should have a cadaveric workshops in India. Here I am situated between two. This is Thomas Grove on the right. He is the first to present the spinal sonograph. And on the left is Vincent, who is first to present the ultrasound of the brachial plexus. Coming back, we bought, myself and my wife. Of course, wife, she bought this. I was not able to do that because this was expensive. And this was the first Titan sonocyte that you would see here. And maybe the sonocyte people may not know about this product. This was 25 years back. I started using it for caudal epidurals, for brachial plexus blocks. It was portable that time. It's not, because PNDT came in, I think, in 2011. In 2006, in AFMC Pune, that was a chapter in our life, where the first ultrasound guided workshop, plexus and nerve blocks, where Gopal was with me, and GP Doraja from Delhi. Three of us, we demonstrated what an ultrasound is, how the needle should be inserted, how the blocks are to be performed. And this was a landmark which I think in our life. In Bangalore in 2011, it was Admir Hadzik who had invited me for my work, and then I presented on infraclavicular block. And this was studied with cadaveric and contrast studies. And he was so happy about my work that he came up to me to one of my stations and asked me whether I would be interested to coming to the US. I said, fine. I thought he's calling me permanently, but it was just for the conference. So I said, fine, I'll come, I don't mind coming. So this was the journey that I started with NYSERDA. And from 2007 until today, I still am involved to some of the other extent in NYSERDA. I delivered a lot of lectures throughout in NYSERDA as well as NVAC. NVAC is Networking Anesthesia Congress, which was held in several countries in Europe as well as in the other places in Southeast Asia. We conducted workshops everywhere. We got trained ourselves because every time you teach, you have something coming back to you. I traveled with my wife, both academic and family commitments as well. This was a very important chapter. In 2011, walking down the streets of Mumbai, myself, Gopal and Bala Venkat, we hit upon an idea of having a platform for regional anesthesia in India. We presented this to Rushali. Rushali said, we can go ahead. And so all 6 of us, we formed the what is now the Aora. And this was a small group which expanded to such an extent that now it has become important for us to have a governing committee like the ExComs, we call them. And this is the one, I think, probably in Indore, where this picture has been taken. And the best important feature is that we have got these live workshops where each of us, we demonstrate. For 15 years, we have been demonstrating live workshops. And now it's the time that the younger generation should come into this picture performing the live workshops as well. And I think it's very important for us to see that we always stay together, united, because it's very easy to disintegrate. So, and there are forces which will pull us apart. So we have to be very cautious that we all stay united. I was hopping from one OT to other OT. I was traveling in 11 theaters when I was doing as a freelancer, as most of the freelancers would know this. And I was trying to wire my brain from jumping from one OT to the other OT, because everybody would be in a different frame of mind. The surgeon, the nurse, the technicians, the assistants, the patients, the patient relatives. So I have to entirely change my concept from one OT to the other OT. And this was taking a toll of me. If you have been working for almost 20, 25 years this way, your brain and your heart is going to get inflamed. It is evidence. There is evidence in this. So you can go back and check this. So I used to check my parameters, and I found myself and my wife that we are going down very much in academics, and we need to do something about this. So in 2015, we took a bold step, and this I called as an Impact Institute, where the Dean Director of this college, of this institute, Dr. Parag Sanchiti, he provided me a platform. And he said that you will be given a good platform where you can upscale yourself in academics. So I said yes to him. I had 3-4 meetings with him, but I was really unsure whether I should say yes or no. I had not informed my family as well. It was only 3 months prior that I informed that I'm going to leave my place, Meeraj. And it was a shock. Now I knew that I have to face all the whims, fancies, and egos of all the people around me. Because I was doing a freelancer where I was my boss. Now you have got a boss of other institutes. But I knew that I'm going to be organized. I'm going to be more protocol based. I'm going to use modern machines. I'm going to have a team of anesthesiologists. And there could be a growth which may be both professional and academic. That is what I thought so. So I turned from a freelancer to a corporate. So whenever I say this, I always feel that there is somebody who's sitting on the top and you are amongst everybody. But I don't know whether you are minutely seen that there's a black. Yes. So that could probably be me. But I know that I'm going to change. So apart from my clinical work, I'm going to do something very different. So I released my first book in Indore. Again, a Aora platform. See how the platforms are important for you. We formed the Pune Regional Anesthesia course. where we invite all the Aorans again. They come, they deliver their lectures, they get involved to a very large extent. They impart their knowledge upon all the delegates. And those who have excelled in throughout their life, we always felicitate them. And we also have international faculties. We have the Sanchiti Research Anesthesia Department here. So this is what changed me from being just a single man and thinking that only I am right and I'm not getting involved with others. This is where we have got very heated discussions, arguments, but everything is for the good of the patient and good for the institute. Now we have something protocol in the department as well. And I make it a point that each one of them, they present something. These are my fellows. Though we started late, I commit, we started late, but we have taken a good leap here, and they are all here with me, Pooja, Naveen, and Reshma. And they are involved with me in all my studies, everything. They do the clinical work, they do the cadaveric work, they do the contrast, and when I inject a contrast, they know that this patient has to go to the CT suite. So they will follow the patient, get it done, put it on the pen drive, and get it back to me. At the end, we have felicitation. Of course, everybody has. And we always honor all the mentors who have imparted their knowledge and provided their skill sets. We have focused learning sessions. So in this, you can see 12 pair of eyes following a needle tip. That is very important. You cannot make a mistake. You cannot commit a mistake at all. And everybody of them will tell you that your needle has to advance or your needle has to be withdrawn. So if these eyes are following you, they may be generous to you. It doesn't matter. You can learn through them. And I learned through them. This was in Mumbai, where Rushali had organized this conference. Again, an Aora platform. See? And I'm going to use this till the end. When I sent my book to Admir Hadjik, he had a comment, and this comment was posted on Instagram. It's very nice of him, and you should have such kind of friends, not only national, but international, at international levels. And whenever we meet, we always have a picture. And he's always overhyped and overexcited to be with everybody. This is another concept. I think we are a product of other people's opinion. This looks like a networking meta-analysis. Vishal would appreciate this. And you have big nodes and small nodes which connect with each other. And the opinion is like you are being praised sometimes, you are being criticized. In fact, you are defined by perception. But I think that you should not be looked into your life through other people's eyes. You should make your old bold move. You should make a statement. And this statement should remain with you until the end. I lacked something, and this is what you should feel. Every time I get up, I think that I lack something. I am missing something. This is what I lacked, a publication. When I met Abhijit Nair, he said that, sir, each one of your slide, it speaks. And I think you should have this manuscript. So when I started writing, the first writing, I sent it to him. He sent me a message. Sir, this is not a story writing. So I went back through the literature, and I thought that I need to improvise my language. It has to be more scientific. And the citations increased, also the publications increased. We did a lot of new blogs which we have released. You can go through all those in the journals. We compared between the non-stimulating and the stimulating catheters in the cervical epidural. Somebody asked me whether this really need to be done. That's a question, whether it needs to be done for upper limb surgeries when you have brachial plexus. So that we have to still find it out. We compared between the stimulating catheters and non-stimulating catheters in lumbar plexus, and we found no difference. Then what's the use of using stimulating catheters? Should we tell the company to stop producing them? This is another important platform, the ISRA. For last 10 years, I've been associated, and I love traveling in Europe because I meet a lot of these friends there, a lot of networking, a lot of knowledge that I get from them, and a lot of knowledge which has been shared. The moment I land in Europe, I start making projects with many of them. In the recently concluded ISRA in Norway, I had two important topics. One was a retrodural space that created a lot of voice in the crowd, a lot of arguments, a lot of discussions, and I liked it. And the second was another where I had like the on-arrival blocks, which they say the blocks in the emergency department. And just being there, I could get on two projects, one with Francisco in Italy and one with Xavi in Spain, in Barcelona. And I'm going next year for these projects. I did have a lot of friends. Rafael, I have daily fights with him regarding the Cordillera Lamorum block. Kijin Shin, he was one of the authors, and Yavuz Gurkan from Italy. Luc Ceremus is retired this year, and Ravan Zundert has received the Carl Kohler Award. Dan Sebastian is from Romania, and Xavier and Belen are from the Spain, Barcelona. Serkan and Ali, they are going to come the next year for the Coimbatore conference. They are from Turkish. It's a Turkish group, and they are really good in all these facial plane blocks. The best for the worst problem is I visualize anatomy everywhere. That is my problem, or that might be my strength. If you look at the tree, I feel that it's the brachial plexus. I just peep out of my window, I see, oh, that's a C5, that's a C6, forming the superior trunk. That has become a big problem for me. We formed the Cadaveric Research Academic Board recently. This is in MGM Navi Mumbai, where we can ventilate the cadavers. I had never imagined in my life that we could ventilate these cadavers. This is a Thiel Emam cadaver. And we could ventilate. I could see the intricacies of the thoracic paravertebral block. And you need to do a lot of before you start a cadaveric workshop. This is where we are earmarking the cadavers. We have to respect the cadavers. We take this oath prior to, and we are going to do it on Sunday as well. And I'm fortunate to have all these course coordinators throughout India. We are going to have a meeting tomorrow. Dr. Manjula mentioned that we should have a meeting. I spoke to Devesh as well. We have anatomists who would teach everything, and there are faculties who would like to get taught themselves. If I find something new, I would immediately call all the faculties and look into this cadaveric specimen and try to analyze what exactly the structure is. If I'm not sure, I would invite the professor of anatomy who's in charge and ask us what exactly is this. You should try to share your knowledge and try to get your knowledge from the others as well. There are a lot of faculties who are getting interested now, and we have plenty of, and they're all Aorians, absolutely. And I thank them all. I have a lot of gratitude and respect to all who have been involved in this. They come on their own, spending on their own. They would be staying there, living their practice for a day or two, and that's really remarkable. And I'm very thankful to all of them. This is in Ahmedabad with Hetal here, yes. And this was in the evening at around 7:30. They were all fully geared up to see the live blocks on cadavers. And this is what we have been doing every time. And at the end, we have a picture, so that I see that they come the next year. In Graz, in Graz with George Fiegel, and in Barcelona with Xavier Sala Blanche, these are the two anatomists who I work with. I went there for a week. I used to start at morning 8, at 7, and our work used to end at evening 8. No lunch, hardly any breakfast, and at the end we used to have dinner. And this in the middle, you can see that at 5 in the morning, we used to wheel the trolleys of cadavers inside the CT scan after injection of contrast. That is the type of the work, that is the dedication that you require, and that is what is expected from each one of us. Why cadaveric studies? You might be knowing that now. You must have already now looked into so many of these studies. It establishes anatomic spaces. It will establish dye diffusions. It will establish differential stain patterns. It will challenge a concept. If you have a concept and if you feel that something is wrong with this, you can challenge with the cadaver and contrast studies. Of course, you cannot really extrapolate, but you can judge it. And you can persist with a hypothesis. This is a dorsal rami block. It's not a ventral rami block. You can also learn the facial planes. One single lumbar plexus, it moves on through 3 spaces. Who would have ever imagined that? If you had injected contrast in all these spaces, you understand they are not at crossroads. but they get blocked in each of these spaces. This platform, I have done everything. I have been designated as the president, director, academic, and chairman as well. And now I am the editor of IGRA as well as the CRAB chairman. Aora has given a lot to me. So equally, you need to reciprocate. You need to respect this dice. And this platform has to be respected throughout your life. And each one of us who step on this dice, so the same is expected from each and everyone. Did I miss anything? A lot. A lot. I have missed everything. Look at that. 2007, I did the deep cervical plexus. 2008, I did the shamrock, which was published in 2016. 2007, I did the trident. It was published in 2008. Caudal catheters, again, it was of course published in 2005, but we could have still made some inroads in those. So you have to publish on time. Please do that. Otherwise, you will miss everything. Look at this. One lady was given a so-called paravertebral block. I missed it, but the patient had pain relief. So I injected contrast. I found that it is lying superficial to the erectospinal plane, but still the patient has pain relief. Why? Ferrero published in 2016. I did not do that. So many things I have missed. This is the reason why you need to publish as early as possible. You need to protect your data. Be very careful about it. I would go to the extent that don't share your data, but share with very, very close people around you. Trust yourself. Do not ask anybody to write for you. Nobody is going to write for you. I had asked many of them. They said, yes, I'll do it. I may do it, but nobody is going to write for you. Write your own manuscript and try to be a leading author. There are a few things that the 3 Ds that you should not have done. These are all the 5 or 6 Ds that you should be doing. Desire, dedication, determination, devotion, and discipline. Because from dedication, from desire is born dedication. That is called as samarpana. Dhriti arises from dedication. Bhakti flows from determination. Niyama comes from devotion. And to have success, that is siddhi, you have to have all these qualities. It has to be imbibed in you every time, throughout your life. Why did I do all this? Is it to satisfy my ego? No. So all these things we have done so that the future generations can get benefited from this. This is the reason why you do this. And I expect each one of you to do this for the future generations. So, never forget your family. Mentors are sacred. Anatomy is not optional. Failure is the teacher. And I think it's the strongest teacher. If you fail to do anything, it helps you, and it's the best mentor, I would say. And students are a legacy. Does my regional anesthesia journey end? That's the big question. We have started the Advanced Regional Anesthesia Research Program in Nagpur. And we are going to look into 2 things. One is the corner pocket, and other is the adductor canal. And we are trying to also look into the brain signals after the blocks with functional MRIs. In Hyderabad, in the wet lab, we are looking into the porcine models and the histological evaluation of cells in interfacial planes after infusion of local anesthetic and the intrathecal space. This is what I was, and this is what I would be in future. This is AI generated, of course, but be careful. Sometimes it doesn't really give the right picture. So friends, in all these 30 years that I have practiced, I think I have lived in a golden era, where we have traveled from landmark guided to neurostimulation to ultrasound. The palpatory method, the twitches, and the visibility of these nerves. From neurolysis to neuromodulation, destroying nerves with alcohol and phenol, to neuromodulation, modulating pain circuits. We have traveled a long way from a lot of uncertainty with landmarks to safety with precision, with neurostimulation and ultrasound, and maybe in future expanding horizons with the other tools that you might have in future. From invisible nerves to nervescopy. So the nervescopy, this project is going to be done the next year, cadaver. Divesh has been here with me for all these crab workshops, and I'm very much thankful for him as well for being with me. So friends, as I stand here today, I am reminded of the colleague we honored at the start, who lived a life of passion, loyalty, and humility. And if I can end my journey with the same values, I will consider it as a success. Blessings to everyone.